We're making a referral for a condition that you have called age-related macular degeneration. So first of all, what in the world is age-related macular degeneration? I think you can see my assistant. This is Bella. She's going to assist in the program today. All right. What is it? Actually, it's a disease almost always in older patients where it is difficult for you to see clearly with the very center part of your eye. That part of the eye is called the macula. It's a very small area directly back into the eye. Whenever you aim at something, you're looking straight ahead. That straight ahead portion, when you project it back to the eye, is called the macula. There's something like 7 million cells in there, and they're called cones. And those cones give you real sharp vision. It's the only portion of your entire eye where you can see 20/20 visual acuity. Now, so what is happening is that basically what it is arteriosclerosis of the blood vessels that supply that center part of the eye. Therefore, they do not get nutrition. So those cells are destroyed. Matter of fact, there was Clint Eastwood did a 2012 movie entitled About the Curve that talked about the plight of a baseball scout that developed macular degeneration. Now, what and where is the macula? I talked about it a little. It's a very small area directly in the back of the eye. The 7 million cells called cones, we've talked about it, okay? Those nerves are so small that a blood vessel, not a blood vessel, but a blood cell is oval in shape. It has to go in sideways to get in there. That's how small all those blood vessels are that feed that part of the eye, to give you an idea of the sensitivity that is in there. Okay? Now, and again, which we mentioned, it's the only part of the eye where you have 20/20 eyesight. Now, then the saving grace is that there are cells around the edge of it. They are called rods. I guess you don't really care about the name, but they're out there. They do not get damaged. So you have mobility. You can see out in your periphery and move around. But the problem is you lose detail. And hence, this is what happened to Clint Eastwood in the movie called About the Curve, because he could no longer see a curveball and to see how well a pitcher would be doing. Now, what was the typical treatment for age-related macular degeneration? Well, eye surgeons would cauterize or photocoagulate with a laser the blood vessels next to the damaged ones in hopes that it will prevent the macular degeneration from worsening. Then it was like burning down the fort to save yourself from the Indians, because so many cells were damaged. And you even saw worse when this happened, and you made the eye susceptible to more damage. So it was questionable treatment at the time. Okay, but what was the alternative then? Well, you did have an alternative nutritional, but the diet regimen is amazing. You had a large number of vitamins of which to select from, and nutritions and things like that. So you had a choice of kind of cauterizing and hope it doesn't get worse, or a large concoction of a bunch of vitamins. So what has happened today? Well, things have changed, okay? You have 3 alternatives, all that are improved. Number one, the photocoagulation has improved with the lasers. They're far more accurate. They touch only the areas they're designated to go and don't seem to be doing the damage that was done before. So that is available now. It was not good before, but it is good now. So that's one alternative. Of the 3, there are 2 of them that are invasive and one's non-invasive. Obviously, when you're sending a laser beam into the eye, that's invasive, but it's helpful for the right person. The second one is you can literally send, with a needle, you put a needle through the eye and put it in an injection real near that macular spot in the front of the eye, supplying it with nutrients. And that has some promise, okay? Obviously, that one is invasive. The third one is natural ophthalmics macular degeneration tablets and an oral spray heads the nutritional regime. You now have a very simple two-step approach. You can take some small pellets that you take and an oral spray. The way that one works is the oral spray is used for the first month to get things started. At the same time you're using pellets, and then after the month you continue with the pellets. So they've taken everything and kind of put it together into one nutritional package, which makes it easier. Now, whether you select alternative number 1 or number 2, you should always do number 3. You should always have a nutritional component in there. Now, why are we referring you to an expert in age-related macular degeneration? Well, just as we practice vision excellence in our office, we work very closely with a practice, which is Dr. Zeider Eye, which practices eye disease excellent. They have a Dr. John Consano, who has years of experience with age-related macular degeneration. We're referring him to you to find out which of those 3 methods are the best, because he's an expert in that field. And he will be advising you whether it should be number 1, number 2, or number 3. And that's what we're referring you for. We're going to be leaving you within good hands, and we'll be receiving a report after.